We're here today because Congress is considering legislation that would cut healthcare programs that millions of people depend on to pay for corporate tax breaks. While the reconciliation package continues to face challenges from recent parliamentarian rulings that have modified some provisions, the core healthcare cuts we're discussing today remain a significant concern for small businesses. Our new survey of 574 small business owners show they strongly oppose this approach. Nearly 7 in every 10 are against cutting healthcare programs to pay for corporate tax breaks. Only 27% support it. Here's why this matters for business owners. More than half of small business owners, their workers, and their families use Medicaid or qualify for ACA tax credits. When Congress cuts these programs, 16 million people will lose their health care. Even with ongoing challenges to the legislation, current estimates still show hundreds of billions in cuts to healthcare programs that small businesses and their employees and our employees depend on. This will increase the pressure on small businesses to shoulder the cost of healthcare. More than half of the small business owners say healthcare cuts will force them to provide expensive health insurance they can't afford. Nearly half say it will make them less competitive against big companies that can offer healthcare benefits to prospective employees. As an employer, I know that is a big challenge already. This means higher costs, workers leaving for benefits elsewhere, and employees missing work because they can't afford to see a doctor. Today, you'll hear from 4 small business owners who depend on Medicaid and the ACA. Dr. Alexia McClurkin owns a sports medicine practice in Houston, Texas, who doesn't have health care for herself and relies on Medicaid for her 3 sons. Dr. Latoya Parker runs an education consulting company in North Carolina and depends on Medicare for her own healthcare needs. Doug Scheffel runs a manufacturing company in Massachusetts and provides benefits, but has employees who depend on these programs. My fellow co-chair of Small Business for America's Future, Walt Rowan, is president of a 115-year-old glass company in Pennsylvania and helps his employees navigate health insurance marketplaces. We also will hear from David Chase, Vice President of Policy and Advocacy for Small Business Majority, who will share findings from a new census data analysis showing that 1/3 of all Medicaid enrollees are connected to small businesses as owners, employees, or their family members. First, we'll hear from the ranking member of the Senate Committee on Small Business, Senator Ed Markey, who has been a strong advocate for small business owners and working families throughout his career in Congress. Now, let me turn it over to Senator Markey. Welcome, Senator.
Well, thank you, Shondell. Thank you for all the great work you do on a daily basis to represent businesses all across our country. You're just a visionary, and I can't thank you enough for all the work that you do for small business, for America's future, for hosting this call on the harm which the Republicans' big, ugly bill will have on small businesses all across our country, all 50 states. It's going to be bad. I also want to thank, especially from Massachusetts, Doug Scheffel, who is the president of ETM Manufacturing in Littleton, Massachusetts, for joining us on this call. You're going to hear from him later. But what he is going to be talking about and the other leaders are going to be on talking about goes for everybody in our country. Okay, and they're just representative of a class of millions of people who are going to be harmed. And I'm doing this with Senator Schumer and with Senator Wyden. And today we sent a letter to Senator Thune and Senator Crapo about yet another consequence of Republicans' healthcare cuts. Small businesses will lose while the ultra-wealthy will win. Republicans are trying to pass over $1 trillion in healthcare cuts, cuts to insurance, cuts to benefits. $1 trillion cut out. and $200 billion in food assistance cuts, all ultimately to wind up paying for tax cuts for billionaires in our country. And these cuts, if passed into by Congress and signed into law by Donald Trump in the next week, which is why this call is so urgent. They want to do this by the 4th of July. So we have a week in order to modify this, a week in order to change what they're trying to do, a week to avoid the harm to small businesses all across our country. Because what they're going to do with their bill, as it's presently constructed, is throw 16 million people off their health insurance, increase some families' medical debts by over $22,000, and force kids and parents and seniors and working families to go hungry. And small business owners, that's why we're here today. Small business owners and workers are going to get hurt. 2.8 million, or 82% of self-employed workers and small business owners with Affordable Care Act marketplace coverage claimed the enhanced premium tax credits that Republicans would let expire. And over 20 million people on Medicaid are connected to a small business, either as an owner, a worker, or a family member. And the tax breaks contained in the bill will not outweigh the money small businesses lose from Republican health care cuts. Small businesses should be able to keep their health care coverage. So it's no surprise that nearly 7 out of 10 small business owners oppose health care cuts to pay for tax breaks for the ultra wealthy. Most small business owners know these cuts will hurt their workers, make it harder to compete with big companies and hit their bottom line. We're talking about Main Street businesses, small businesses all across our country who are going to be seriously harmed by this bill in terms of loss of health care coverage. Republicans are doing a disservice to small business owners all over the country by not closely analyzing these impacts and making sure small businesses are aware of how they will get hurt. But if Republicans won't be transparent, I will be transparent right now. This isn't a bill that supports working people, hardworking entrepreneurs. It is a bill that sells out Main Street to protect Wall Street. It is a big, ugly burden for small businesses, and it's only going to get harder. It's going to be more difficult because to the small business owners and workers who are here today to share their stories and who have been speaking out against this bill, this big billionaire boondoggle, we thank you all for being here and sharing your stories. 10%, the numbers are unbelievable. 10% of small business owners claiming enhanced premium tax credit will lose their access. 10% are going to lose their access to the benefit, and it'll happen by the end of this year. If this bill passes, they're out of luck in terms of getting coverage. So that's 10% that lose, and that's a guarantee if their bill passes. And small business owners will see their premium increase by 93%. So that's just unacceptable. And that's what this whole forum is going to be about. It's about the stories of small business people all across our country and the millions of people who work for them or actually are the entrepreneurs who run these small businesses. So if we just tell this story by the numbers, and that's what small business people have to do every single day, they just have, their numbers in front of them. Are they going to be able to make it? Are they going to be able to crack that nut this week, this month, this year? Well, this is just going to be an additional Sisyphean boulder that's put on their shoulders in their efforts to try to make it. These cutbacks in healthcare are going to be catastrophic. So now I'm going to just pass it back to Shondell, and I look forward to hearing from all of the great entrepreneurs that we are going to hear from today.
Well, thank you very much, Senator Markey, and I really do appreciate the work that you do and the service that you provide in public service, along with my representatives, Catherine Cortez Mastos and Jackie Rosen. I really appreciate the work that you guys do in supporting us as small business owners. Folks, the senator will stay on as long as he can, but with everything happening in the Senate this week, he may need to jump off before we get to Q&A. If you have questions specifically for Senator Markey, just reach out to his staff. We'll put the information in the chat, and his team can get back to you. Our next speaker will be David Chase, Vice President of Policy and Advocacy for Small Business Majority. David, thank you and welcome.
Great. Thank you so much, Shondell. It's great to be with you all today. Again, I'm David Chase, Vice President of Small Business Majority, and we're a national small business advocacy organization that we are focused on empowering small business owners to create a thriving and equitable economy. We work on a wide variety of public policy issues, but the issue we've done probably more work on than any other issue would be healthcare. Small business owners struggle to offer employer-sponsored coverage for themselves and their employees. When a small business owner does not offer an employer-sponsored plan because they simply cannot afford to do so, the business owner, the employees, and their families still need access to health coverage. And an important but sometimes overlooked healthcare option for those that work in a small business is Medicaid. So we recently partnered with the Georgetown University Center for Children and Families to look at the connection between small businesses and Medicaid. And by utilizing U.S. Census data, we worked with Georgetown to look at the total number of small business owners, their employees, and their families who rely on Medicaid coverage. To our knowledge, this is the first report of its kind to calculate the total number of individuals connected to a small business. The findings are being released today, and I'm excited to share some of the highlights with you all right now. So our report shows that 1/3 of all people enrolled in Medicaid nationwide are connected to a small business. That's 1/3. So this is specifically small business owners, employees, and children or other family members of those owners and employees. This includes approximately 21 million children with parents who are self-employed or work for a small business. We know small businesses face higher healthcare costs in the private insurance market, making Medicaid a vital insurer for lower wage earners and their families. The census data also shows that nationwide, 20% of small business owners, employees, and their family members are covered by Medicaid. So large cuts to Medicaid that are moving through the Congress would result in millions of people losing health coverage and becoming uninsured, which would threaten the health and economic security of a significant portion of the small business workforce. Now, a look at the regions across the country finds that the Northeast and the Western regions have higher shares of small business connected individuals enrolled in Medicaid than the national average. The South, on the other hand, has the lowest share, which is most likely because many large states in the South, such as Texas, Florida, and Georgia, have opted not to expand Medicaid to low-income adults under the Affordable Care Act. In fact, the data shows that people who earn their living at small businesses are more than twice as likely to have Medicaid coverage in expansion states than in non-expansion states. And as a consequence of higher income eligibility levels for children than adults, children are more likely to have Medicaid coverage than adults in general. Children and families connected to small businesses have higher rates of Medicaid coverage, 38% for children connected to a small business, as compared to adults at 14%. And interestingly, almost 1/4 of small business owners have children covered by Medicaid. So Congress is considering the largest cuts to Medicaid in history. If these cuts go through, millions are expected to lose coverage, and states will face significant budget challenges if these cuts are enacted. So our findings underscore that Medicaid plays a vital role as a health insurer for children and low-wage workers who earn their living at a small business. Medicaid cuts put the health and economic security of a significant share of the small business workforce at risk. Any disruptions to Medicaid would be harmful to entrepreneurs and people who earn their living working for a small business, as well as their family members, and the ability of small businesses to continue to fuel job growth. So I will include a link to our report in the chat. I'll do that now. And actually, I have to hop off to another call actually to officially release the results of the report that I just shared. So thank you all for having me, and Shondell, I'll hand it back over to you.
Thanks, David. That was great information. We do appreciate you for joining us, and the time. We know your time is limited, but we do appreciate you. Now we'll be hearing from our small business owners from the Small Business for America's Future Network. We'll start with Doug Sheffel, president of ETM Manufacturing in Littleton, Massachusetts. Welcome, Doug.
Good morning. Thank you for having us. So my name is Doug. I'm from ETM Manufacturing in Littleton, Mass. My wife and I bought ETM Manufacturing in 2018 with a very simple philosophy of if we take care of our people, they'll take care of our business. And after 28 years of working in the aerospace and automotive fields for companies like Pratt & Whitney and Eaton Corp, quality isn't just about products and services, it's about the people too. So that's why we offer our roughly about 20 employees a really comprehensive pay and benefits program that includes a 401k, includes paid family and medical leave, and a really robust medical, dental, and vision coverage, medical coverage for our full-time staff. We invest in our workforce because we believe that it's the right thing to do, and it's the smart thing to do. But even with our best efforts, it's really expensive to try to cover everyone, and that's what we're talking about here today. And so several of our employees rely on Massachusetts the state healthcare exchange for coverage, and others are caregivers of children and grandchildren who depend on Medicaid for really unaffordable prescription drug medications that would largely, drive financially trouble for them individually. They can't afford it. So when I hear about these potential cuts to programs, I'm not just worried as a citizen. I'm also worried as a business owner who depends on a stable and healthy workforce. So I'll break it down from a manufacturing perspective. In our industry, we work really hard to build systems and processes that consistently and reliably work and deliver products that people want. You don't take parts out of that system when it's running, and you don't break it apart and take parts away. And it's just really important we don't do that. So, but that's exactly what these proposed healthcare cuts would do. The ACA marketplace and Medicaid that help keep our workforce stable and healthy are being cut. And when you cut them, you're removing something that really helps our economy work and function. From an operations standpoint, this creates significant instability. If my employees lose access to affordable coverage through exchanges, or if their family members lose Medicaid, what happens? Suddenly, our company is dealing with workers who are stressed about healthcare costs, potentially missing work for untreated conditions, or leaving for jobs with better benefits. According to the most recent Small Business for America's Future survey, 43% of small businesses would see higher employee turnover if healthcare programs are cut, and 41% predict worker productivity could decline due to untreated health issues and health concerns. The economic uncertainty we're already facing makes this even more challenging. Small manufacturers like us are trying to navigate supply chain disruptions, workforce shortages, and fluctuating demand. The last thing we need, to be honest, is another variable that makes it harder to maintain a stable, productive team and business. What's particularly frustrating is that we're talking about cutting programs that work to fund tax breaks for large corporations and wealthy individuals that, and particularly on the large corporation side, are competitors for talent and contracts. These big companies have advantages we simply can't match. Cutting the healthcare programs that we rely on just widens that gap and makes it more difficult to compete. My background taught me that sustainable solutions require long-term thinking, not short-term cost cutting that creates bigger problems down the road. We need policies that strengthen small businesses, not tear them down, to pay for tax cuts that don't help Main Street manufacturers like us build a future that we're all counting on. Now I'd like to introduce Dr. LaToya Parker, owner of Energy Educational Consulting Company in Fayetteville, North Carolina. Thank you.
Thanks, Doug. As the Doctor of Education and year-round academic consultant, I'm passionate about my small business of personal development and academic improvement to help the students in my community in and around the city of Fayetteville. It starts with the term I created in COVID called energy. Energy simply means doing the work inside of yourself first. In order for my students to begin to believe that this is attainable, their inner physical systems must first work properly together. These inner systems include the nervous system, respiratory system, circulatory, and every little system in their little bodies. This is extremely important in early learning and development. At my small business, Energy Education, we encourage students to eat better, to dance, to love life, to exercise, but most importantly, we encourage their parents and guardians to take them to a medical doctor. My research suggests that nearly 70% of my customers rely on Medicaid. Therefore, I am committed to remaining an income-based community service of a business in North Carolina. As an educator turned businesswoman and now educational leader, I will face challenges that go far beyond my business plan with this threat to Medicaid. Personally, Medicaid has been crucial and critical to my own health and essential to preventative care. I proudly actually share that I have a mammogram scheduled in the morning. I'm very proud of that, and I encourage other women to do the same. I also would like to talk about my daughter, who had a very successful dental surgery just last week. Just last week, she had a very successful dental surgery, and I have Medicaid to thank for that, because that costs up to about $5,000 that I do not have as I provide services for my community. According to the recent Small Business Future America survey, 58% of small businesses have owners, employees, or family members who rely on Medicaid or CHIP coverage. It's very comforting to know that during these times, I'm not alone in this. Instead of cutting programs that Main Street depends on, we need policies that help small businesses. We can achieve this by helping small business owners provide healthcare options that support expanding the ACA premium tax credits, or quite simply, just protect our Medicaid system. Taking away Medicaid will create a snowball effect of other resources, such as affordable housing, and most recently, the snatching of grant funding opportunities from my tutoring school that's based on clean energy and EPA goals. In closing, I fervently believe that Medicaid is a resource is needed for any individual to live a purpose-driven life. For the individuals who need it, it is a lifeline. And furthermore, every student deserves a safe and healthy environment. From their homes, community, school, and local surroundings, every child deserves a sense of safety. The most important environment we will ever have is our bodies, that only we know through our lived experiences, no matter what age we are at. Medicaid for those who need it is a vital resource in protecting our students' most precious environment of all, which is their body. Thank you so much for listening. And now I would like to introduce to you Dr. Alexia McClurkland, owner of the Wellness Doc.
Thank you so much, Dr. Latoya. So I'm Dr. Alexia McClurkin. I own the Sports and Wellness Doc, a sports and regenerative medicine practice here in Houston, Texas. Here's something that might shock you. I'm a healthcare provider who can't afford healthcare for my own self. And after 9 years of being in business, treating everyone from professional athletes to working families, I still have to pay for every doctor's visit out of my own pocket and medical procedure. Why? Because health insurance premiums now cost nearly $9,000 just for single coverage and over $25,000 for families. And I had to go to the doctor a few months ago to see a specialist for some issues that I had going on, and it was $2,500 just for the labs and for the scans. So I had to just pass on it because right now, honestly, I just can't afford it. And the only reason why my 3 young sons, they're 11, 7, and 2, have healthcare is due to Medicaid. And there's, when I tell you, I mean, we can talk about 3 boys here, fractures, things like that. They're sick all the time. So this is our lifeline. My husband can't afford to carry all of us on his insurance, and he's a teacher. So we already know where that's going. And now Congress wants to gut these programs just to pay for tax cuts for wealthy corporations. Well, what about the small business owners like us? The proposed work requirements, I mean, they're a disaster waiting to happen for businesses like mine. And healthcare schedules are so unpredictable. Someone calls in sick, we have emergency patients, we have hours that fluctuate. The proposed 80-hour monthly work requirements will put impossible pressure on the workers and small businesses alike. People could lose coverage even while they're employed just because their hours vary. How is anyone supposed to work with that, right? And if my employees lose Medicaid, I'm stuck. Right now, I have an employee that is pregnant. Thank God her husband has VA benefits, so that's covering her. But another employee that I have, she has nothing. So either way, I got to somehow find money that I don't have. I got to pull it from trees, shake some trees. I mean, I don't know. Or I lose good workers to bigger companies because they can afford these benefits. I can't. And then also a survey shows 52%, that's a large amount, 52% of small businesses will face the exact pressure if Medicaid gets cut. So what are we supposed to do now? Let me paint a picture for you of what this looks like on the ground. I have patients who can't afford care because because of the insurance companies slashed my reimbursements. So we're going up on premiums, we're going up on deductibles. People cannot afford that. However, us as providers, we're getting cut. So where's the money going? I would like to know. And then Medicaid doesn't even cover certain services. Actually, they really, for us as a chiropractor, they only cover just the adjustment. So now patients have to try to pay cash out of pocket so they can get the extra care that they need and often can't. And then I find myself, because I'm an empath, wanting to help these people, I just go ahead and just write off the services because I know that they need it. And I've had athletes offer to trade Instagram posts for treatment because they're struggling. Everyone's struggling. They have NIL deals, but everyone's not going to get these NIL deals. And then the kids that are good, but they're not good according to everyone else's standards. They can't afford the services. And then the real kicker, poor workforce health already costs $575 billion annually in lost productivity. These cuts will make that worse, not better. I chose healthcare as a profession because I wanted to help people heal, but I cannot do my job effectively when my patients can't afford care and I can't afford coverage for myself. Medicaid, while it's not perfect, but it's what's keeping my boys healthy and allowing families throughout my community to get the care that they need. Taking that away to fund cuts for corporations, that's not just bad policy, it's abandoning the people who make our communities work. Thank you so much for this opportunity, and thank you, Senator Markey, for listening to us. And now I would like to introduce you to Small Business for America's Future co-chair, Mr. Walt Rowan, owner of Susquehanna Glass Company in Columbia, Pennsylvania.
Well, good afternoon, and thank you very much for the introduction. Let me just get something here. Yes, my name is Walt Rowan, and I'm co-chair of the Small Business for America's Future. But I'm also president of my family business, Susquehanna Glass Company, which is in Columbia, Pennsylvania. We are a third-generation family business, and it is a 115-year-old glass decorating company. For many years, my company was able to provide health insurance for our employees. We shared the costs because it was the responsible thing to do as a family business, because we're in the community for over a century. But soaring healthcare costs for most small businesses put employer healthcare out of reach for us. To give you an example, if we had kept our employer-provided insurance, some of my older employees would have seen their monthly premiums increase from $500 a month to over $1,500, which is a completely unaffordable amount for almost anybody but the wealthiest of people. So about 2 years ago, we made the decision to drop our coverage and to help our employees navigate into the individual ACA marketplace here in Pennsylvania, where many of our employees were then able to qualify for subsidies, which then made the health insurance premiums more affordable. These enhanced premium tax credits are an essential tool that helps my employees get affordable coverage. If these credits go away, many of my 35 employees would face an impossible financial situation. But these enhanced premium tax credits are set to expire this year, and the H.R. 1 fails to extend them while cutting other healthcare programs to fund tax breaks for large corporations. Let me share some statistics from a recent Small Business for America's Future survey. 56% of small business owners who responded have employees or family members using ACA marketplace coverage with these premium tax credits. If they disappear, that will have a dramatic impact on the small business ecosystem. Think about what this means economically. 52% of small businesses surveyed say we'd face new pressure to provide employee healthcare coverage, directly hitting our bottom line. 48% say cuts would make it harder to compete with large companies in hiring. The frustrating part is this is happening while small businesses are already dealing with unprecedented economic uncertainty. At Susquehanna Glass, we're navigating erratic tariff policies that have disrupted our supply chains and market volatility that makes planning nearly impossible. What's ironic is that large corporations that got a massive 40% tax rate reduction are now getting more tax breaks, while small businesses that create 2/3 of new jobs are being asked to shoulder new healthcare costs. Most of us didn't benefit from the small business tax deduction in the Tax Cuts and Jobs Act that was supposed to help Main Street. And now we may have to absorb increased costs when healthcare programs get cut. This is untenable. What we need are policies that expand our options and make healthcare more affordable, not policies that rip away tools we have now to deal with higher healthcare costs. The ACA marketplace, supported by premium tax credits, has been a lifeline for my employees and thousands of other small businesses across America. After 115 years, I want to ensure Susquehanna Glass can continue providing good jobs in our Pennsylvania community. But that requires policies that support small businesses, not shift costs onto us while giving tax breaks to those who need them the least. Back to you now, Shondell.
Thank you, Walt, and thank you everyone for your insightful comments on how this legislation will impact small businesses. Now we have time for questions and answers. If you would like to ask our participants a question, please raise your hand via Zoom and we will call on you after everyone has spoken. If you have called in on the phone, there is no raise hand function. You can either log in with the Zoom link we provided or follow up with the SBAF team after the event and we will get an answer to you. I didn't see anything in the Q&A, nor the chat, and I'll check again. But if you want to raise your hand, we can call on you. Not seeing any hands raised. I want to thank you for attending today. If you have any questions, or want to follow up with any of our business owners, please reach out to Janelle Truler with small business at communications at smallbusinessforamericasfuture.org. Thank you very much for your time and attention, and you could always follow up with us if you have any other questions or concerns. Go to smallbusinessforamericasfuture.org for any other questions, comments, or additional information. Thank you.